Beef basically causes colon cancer. They have tons of sugars, tons of preservatives, nothing else.
You are saying someone is advertising it is healthy, it is not healthy.
So from my side, I've started an organization called Beacon of Hope Cancer.
So is it a marketing strategy or people should follow this organic fruits, vegetables?
But once cancer affects, they don't care about anything. Ultimately, kids learn from their parents.
Here I have a question that how this usually I have read in one article that if you eat sugars that will fuel the growth of cancer cells. Why is it so?
This is, in scientific terms, is called Warburg's effect. Warburg, Warburg's effect. That is, the cancer cells, they love glucose. The more glucose, they need more fuel. Because as you see, what they say is cancer cells multiply. See, for anything you need energy. So cancer cells has a way of getting energy from your body and depriving your other cells of the energy that they need. That's why you feel weak.
Okay.
So energy comes from glucose. So the more glucose you take, the more happy cancer cells are, and they keep growing. So what happens when you take sugary drinks is, for example, one of the mechanism is your insulin goes up to decrease your glucose. So these are called insulin spikes. So the more number of sugary drinks you take or sugars you take or anything, more number of insulin spikes, and these insulin produces insulin growth factors in your body, and those help in increasing the cancer growth.
Dr. Praveen sir, if you see the Indian scenario, every weekly once, mostly very common, mostly they will take a meat. Based on the place they living, they buy some, in Coimbatore, we can get us some fresh foods, fresh meats. And if it is in Mumbai and Bangalore, they can able to get some, mostly the packaged meats. As per the WHO statement that it is carcinogenic. Tell us that how this affect cancers.
Yeah, so this I will tell from my own experience.
Even once in a while, right? They
Yeah,
take
yeah.
only Sundays. We monthly they take only 4 times.
Yeah,
Even
yeah.
that also cause cancers.
Yeah, so this I will tell from my own experience. So what meat you said, the processed meat or the red meat, for example, that you said, beef and all that is actually graded as a group 1 carcinogen in WHO. Like how you rightly said, it causes cancer.
So we see a lot of advertisements in that they're stating that it is healthy and healthy, fresh, like that. So what you say about how these kind of they're stating the healthy foods? How you say this as a cancer causing foods since it comes under packaged one?
Yeah, so this also I'll tell from my experience. So this I started to run marathons around 6 to 7 years back. Like me, I run around 42 kilometers, full
42
marathon.
kilometers, one
Yeah.
stretch.
Yeah, at one stretch. We run all that. So for that, we need fueling. So for that, we have like multiple items. There is one separate set on the supermarket, sugary drinks, energy drinks, then healthy bars, protein bars, granular bars, all those bars which are touted as health drinks. Okay, then ultimately you go see their package, their label. That's why many of them says you go see the label. They have tons of sugars, tons of preservatives, nothing else. They have nothing to do with health, though they claim themselves to be a health drink. They just increase your carbohydrate thing that you need for running. But ultimately, whatever advantage you got by running is gone because you just mitigated it by taking all these so-called healthy foods, which are actually bad for your health in a lot of ways.
You are saying someone is advertising it is healthy, it is not healthy.
So all these healthy foods, whatever you said, you basically do exercises to lose weight. But these healthy sugary foods basically increase your weight. And that has resulted in a pandemic in US, even in India. Around 40% of Indians, 43% of Indians are considered obese. We consider ourselves a third world country, but still obesity is so rampant here. And obesity causes 10 to 13 varieties of cancers. Obesity themselves. The most common cause in ladies, most common cancers are breast and uterine cancers. Both these cancers are caused because of obesity. So obesity is basically a killer.
So I said I have read about you in GKN website. There also I found that you published some journal on inflammation causing cancer. Tell about that journal.
Yeah, so this is an international journal where actually I actually researched about multiple markers, which are inflammatory markers and whether they correlate with cancer, in this case mainly breast cancer. So what I found is, especially in patients with breast cancer, depending on their aggressive nature, these inflammatory markers are elevated, and the more elevated they are, the more aggressive the cancer is. So there is a direct correlation, and this journal has actually been cited in multiple, like more than 500 to 600 other journals have cited this. So this is an authentic journal, actually.
What is the summary of that?
Yeah, so basically what I said is inflammation is one of the major causes of cancer, and we can find it out. We can find out the aggressiveness based on the inflammatory markers. So these inflammatory markers are basically like what I said, one of the main cause of inflammatory markers is food. But that I didn't deal with that in the paper, but that was what the paper was.
You, as a cancer surgeon, so anyone get a cancer, they diagnose as a cancer, then they have a lot of expenditure to make to come out of it. And what you do for that?
Yeah, so like how I initially said, I was in Assam 4 years, and there it was like a totally service oriented. So my mentality was, if you come back to Coimbatore mostly has middle class and upper middle class people. That was what I was born.
No, there is a lot of poor people.
I know. That was my initial perception of Coimbatore. But then I started to work here, and then I came to know that there are a lot of poor people here also. They need help. Yeah, my service in GKNM, 2 or 3 patients could not afford cancer treatment, and they had to go out and take treatment elsewhere. We were not informed, basically. Though GKNM does surgery at a very subsidized cost, they were not able to afford that too. They went outside, they got surgery done, and then it resulted in complications, and then few patients died. So then I realized that just doing surgery, just confining yourself to treatment is not enough. You need to go beyond that and help people. So from my side, I've started an organization called Beacon of Hope Cancer Foundation.
Beacon of Hope Cancer
Foundation. So it's an NGO. It's a registered NGO with its own MCA registration, Ministry of Corporate Affairs registration, ATG, 12A certificate, everything is there. So this is mainly to help poor people to get advanced cutting edge technology. As you know, GKNM is one of the pioneers to introduce cutting edge technology in the medical field. So here in GKNM, we have cutting edge laparoscopic surgery, and along with that, we have cutting edge robotic surgery also. So many people are not able to afford that. So we all know that laparoscopy, robotic surgery, they are high end. They are good for the patients. So using robotic surgery, your vision is good, and apart from that, the patient recovery is excellent. There is less blood loss, less pain. But again, the investment is high, so the cost is also high. So one of my aim is to offer laparoscopy, robotic surgery, if possible, at affordable rate.
So if you're watching the video and you want help and support Dr. Praveen initiative, Beacon of the Hope, a cancer foundation, and doing I speak that you will see a QR code or a GPay detail. If you want to support him, do support him. Or also I'll give his email and phone numbers. You can reach out to him to take care of any one cancer expenses. And if you do so, and if I come to know that you helped him, Dr. Praveen, I'll put your photos in our next video. Do support him.
It's an excellent initiative. Thank you. Thanks a lot.
My pleasure, Dr. Praveen. Tell about as gut health, how gut healths are important in the lot of the time. If you see in the recent media, the microbiome, everyone say about microbiome. We normal people don't know what is microbiome. Please go ahead.
Yeah, so this is a really hot topic now, gut health. So what they say about gut health is this is actually the second brain. The gut is the second brain. Because inside the gut, we have around 1 trillion microorganisms. We have something called the good bacteria. So that takes years to develop. So our entire gut is lined by trillions of microorganisms, which basically help us. So suppose any person takes even a single antibiotic course, that goes and affects these good organisms, and they die, and they get colonized by bad organisms. So most of the food we take, like how I said, packaged food, everything, they have carcinogens. Carcinogens are cancer-causing substances. These are actually metabolized, broken down by the good bacteria. Suppose if these good bacteria are not there, we have only the bad organisms. These carcinogens play havoc, and they result in cancer. So apart from that, these good organisms also, what they do is they control the hormonal mechanism in the body. So suppose if these good bacteria is not there because of any cause, then there is a lot of estrogen production. Estrogen is the female hormone,
Okay.
and that results in a lot of cancers. So gut health is very important.
So I want to go a little deeper. So do you have any of the patients who you treated so far in your personal journey? Anyone who took the proper diet that you suggested? Have you seen the recovery?
I've seen one patient with gastric cancer whom I operated. He actually had very bad diet habits. After surgery, after finishing chemotherapy, he took up dietary changes as one of his passions. He followed, after a lot of research, he wanted to follow veganism along with a certain bit of Mediterranean diet, taking whole foods, whole seeds, fish, and a lot of omega-3 fatty acids and all that. So right now, if you see his health, you will be amazed. You will not think that he had cancer at any time, and he's also a celebrity of sort. And he goes and gives a lot of advice. Such patients who go through the experience and who have recovered well basically become a big inspiration not only for patients, even for us.
So you are telling that dietary changes definitely improve the
Definitely.
progression of it will stop the progression of the cancer.
It will delay the progression of cancer. It can also stop, definitely, like how you said.
So what one piece of advice you want to give yourself when you are younger?
When I was younger, I used to take a lot of stress.
Mm.
So I wanted to become a doctor. I used to keep studying, and all that. So stress is also a cause. Stress results in a lot of hormonal changes. It increases inflammation in your body, and there is something called epigenetics. Epigenetics is there is no changes in the gene, but the expression of the gene gets altered. So expression is whatever signal the gene gives. Suppose it's going to tell to do something, it doesn't do that way. Though there is no changes. Stress is a major cause of these epigenetic changes. I would prefer myself to have been a little more stress free. And actually, coming to foods, we used to take a lot of fried foods, but thankfully, homemade fried foods. And apart from that, a lot of pickles. Pickles, what I found now, pickles almost with everything, with upma, with curd rice.
Why?
Because it's tasty. And now I found that pickles is bad because it changes a lot of nitrates. It has a lot of nitrates. Those gets converted to nitrosamines, and those are the major cause of stomach cancer.
Mm.
One important historical thing is all of you would know about Napoleon Bonaparte.
Mm.
He actually died out of stomach cancer,
Uh-huh.
and he had an inherited gene. His father also died out of stomach cancer. His grandfather also died out of stomach cancer. It has nothing to do with diet. Just bringing it up.
This is my last question for you. What one piece of advice that you want to give someone watching this video? And that should be the topmost thing that you should say, and so that they live a cancer free life.
The one piece of advice to basically live your life,
Mm.
not only cancer free, to be anything for that matter, is to understand that you have only one life, and you are not replaceable for your family.
Yes.
Whereas in your workplace, you can be replaced. So focus on your health. Primarily, focus on your health, focus on your well being, focus on being with your family, who's the most important. Be stress free. See, we don't know what's going to happen tomorrow. We don't know if the world is going to exist, or it's going to be destroyed. The least you can do is be happy at this moment. Being happy itself decreases a lot of tension in you. It kind of rejuvenates your entire system, and it leads to a more productive life, basically. So basically the thing is, advises to live your life to the fullest, be stress free, and pray to God.
Thank you, Dr. Praveen. That was wonderful. We had a wonderful podcast.
Excellent, thank
So
you.
thank you for being with us. If you like this video, please definitely subscribe this channel and share your friends who is not having good food habits, and tell them that how food habits impact their life. And we have a WhatsApp group. You can find in our YouTube channel. There is a link there. You can find out WhatsApp group and Telegram link. If you join those groups, you can ask any question related to cancer. We will get those questions and get answer from doctor and post you. Also, you can write a comment on this video also, so that it will boost us in SEO also. So do subscribe and appreciate our effort. Thank you so much. I'm coming with next wonderful topics and meet you again.